Assalamualaikum and hi everyone. We will present about allergy. First, I will introduce about our group members. My name is SHAHIDA NAFISAH binti BUHAIRA. My matric number is F18A0164. Next, AMIRAH FAZILA binti JAMALUDIN. Matric number is F18A0001. Next, SITI NORFAIRAH binti Amran. Matric number F18A0275. Next, FARAH ALIAH binti HASAN. Matric number F18B0029. Next, ALYANI binti MOHAMAD AMIN. Matric number F18B0133. Lastly, MIZA SABRINA binti MOHD RADZI. Matric number F18A0258. What is allergy? Allergy is an abnormal immune response when exposure to foreign substances that actually harmless to most people. Usually, immune system respond to pathogens such as bacteria and virus. This allergy reaction because of particular antibody which is immunoglobulin IgE. This antibody was released to destroy allergen while produce the chemicals that trigger allergy reaction. People are prone to allergies called as allergic. Allergic is the hereditary disease. We have higher tendency to develop allergy when our parents have allergies. Allergies may develop when our immune system is weak and at the same time exposure to the allergens. Allergic reaction can range from mild to severe. Sometimes it can trigger life-threatening reaction. Allergen. Allergen is foreign substances that harmless to our body but got respond because of the hypersensitive immune response. The example of allergens are insect bite such as mosquito and bee. Next, metal. Other than that, environment such as pet dander and pollen. Next, latex products such as glove. Medicine such as penicillin and antibiotic. And lastly, food such as peanut and seafood.
Next, mechanism on how allergy happen. In people with allergies, however, the immune system also reacts to substances, producing allergic reactions. Such substances called allergens can come from patients' natural environment, food, medications, latex products, or insect bites. Most allergies are mediated by a class of antibody called immunoglobulin E, IgE. IgE is produced when the body is first exposed to an allergen. Production of IgE is activated by a subtype of T lymphocyte known as the type 2 helper T cells, Th2. IgE then bind to their receptors on the surface of the mast cells and basophils. The first exposure is usually symptomatic, but the body is now sensitized. Upon re-exposure to the same antigen, the antigen binds to adjacent IgE molecules, bringing their receptors together, triggering a signaling cascade that induces the release of histamine and other inflammatory chemicals. These chemicals cause dilation and increase permeability of blood vessels, mucus secretion, stimulation of sensory nerves, smooth muscle pumps, and are responsible for allergic symptoms which can range from mild to severe. Next, a slide will explain more about allergic symptoms.
Now, I will talk about what contribute of allergic disease. Allergy occur when our immune system reacts to a foreign substance such as pollen, bee, venom, or pet dander, or a food that doesn't cause a reaction in most people. Our immune system produce substances known as antibody. When you have allergy, your immune system makes antibodies that identify a particular allergen as harmful even though it isn't. When you come into contact with the allergen, our immune system reaction can inflame our skin, sinews, airways, or digestive system. The severity of allergy varies from person to person and can range from minor irritation to anaphylaxis, a potential life-threatening emergency. While most allergies can be cured, treatment can help relieve our allergic symptoms. An allergy starts when our immune system mistakes a normally harmless substance for a dangerous invader. The immune system then produces antibodies that remain on the alert for that particular allergen. When you're exposed to the allergen again, this antibody can release a number of immune system chemicals such as histamine that cause allergic symptoms. Common allergic triggers include airborne allergens such as pollen, animal dander, dust mites, and mold. Certain food, particularly peanuts, tree nuts, wheat, soy, fish, shellfish, egg, and milk. Insect stings such as from bees and wastes. Medication, particularly penicillin or penicillin-based antibiotics. Latex or other substances use starch, which can allergic skin reaction. Other factors that contribute to allergy is if they have a family history of asthma or allergy, such as hay fever, hive, or eczema. Asthma, atopic dermatitis, allergic rhinitis, and food allergy are the most common allergic disease affecting children, and the prevalence of this condition has risen in recent years.
Sign and symptom. The symptom of allergy such as rhinitis, conjunctivitis, asthma, skin reaction depends on the type of allergen and the port of entry. Some reaction may be localized and limited, while others could be involve multiple body system. The reaction to the same allergen vary amongst individuals. Symptoms of an allergic reaction usually develop within a few minutes of being exposed to something allergic to, although occasionally they can develop gradually over a few hours. The most common allergic disease is rhinitis or allergic conjunctivitis. Studies have shown that the ratio of affected are 1 out of every 5 people worldwide and frequently associated with asthma. Allergic reaction can range from mild to severe. In some severe cases, allergies can trigger a life-threatening reaction known as anaphylaxis. Depending on the type of allergen and the port of entry, the following or different conditions can be found. In moderate allergic reaction symptom, the first is conjunctivitis or known as pink eye, usually occur in both eyes, that can produce intense itching, tearing, and swelling in the eyes. It may occur with symptoms of allergies such as an itchy nose, sneezing, a scratchy throat, or asthma. Next is rhinitis. Rhinitis, or known as hay fever. The symptoms are similar to the symptoms of a common cold. Some common symptoms include sneezing, congestion, coughing, sinus pressure, itchy watery eyes and itchy nose, mouth, throat, and fatigue. For allergic asthma, the symptoms are generally the same as those of non-allergic asthma. They include cough with or without expectoration, suffocation, wheezing, difficulty breathing, and tightening of the chest. Next is atopic dermatitis. Atopic dermatitis is the most common form of eczema. It usually starts in childhood and often gets milder and goes away by adulthood. The symptoms are rash located on skin fold, dry skin, itchy may severe at night, red to brownish gray patches especially on the hand, feet, ankle, wrist, neck that occur frequently in children. Small and raised bumps which may leak fluid and cross over when scratched. Urticaria known as hive. The symptoms are patches of red or skin-colored welts which can appear anywhere on the body. Welts that vary in size, change shape, and appear and fade repeatedly as the reaction runs in course. Itching. The itchiness which may be severe if prolonged. A tendency for sign and symptom to flare with triggers such as heat, exercise, and stress. Next is angioedema, or known as giant hive. The symptoms are swelling with a red-colored rash beneath the surface of the skin. It may occur in a localized area on or near the feet, hands, eyes, or lips. In more severe cases, the swelling can spread to another part of the body. Last in moderate allergic reaction symptom is contact dermatitis. Contact dermatitis is a rash on the areas of the skin that came into contact with the allergen. The symptoms associated with allergic contact dermatitis include a red rash, itching, which may be severe, dry, cracked and scaly skin, bumps and blisters, sometimes with oozing and crusting, swelling, burning or tenderness. In severe allergic reaction symptoms are anaphylaxis. Anaphylaxis is a rare life-threatening emergency in which the response to the allergen is sudden and affect the whole body. Allergy symptoms may react within minutes progress to more serious symptoms. Anaphylaxis is an allergic reaction to venom, food, or medication. This causes a series of symptoms include skin rash, low pulse, nausea and vomiting, breathing difficulties such as fast or short breathing, wheezing, loss of consciousness, lightheadedness, swelling, and a shock which known as anaphylactic shock. Some cases, it can cause sudden death.
For a diagnosis part, number 1, symptoms. The doctor will ask the patient questions regarding symptoms, when they occur, how often, and what seems to cause them. Number 2, the patient history. The doctor will also ask the patient with symptoms whether there is a family history of allergies and if other household members have allergies. Number 3, the doctor will either recommend some tests to find out which allergen is causing the symptoms or refer the patient to a specialist. Then, under the allergy test, it may involve either a skin test or a blood test. The elimination diet may be suggested if the doctor thinks you might have a food allergy. Number 1, skin test. Skin tests are used to identify numerous potential allergens. These include airborne, food-related, and contact allergens. There are 3 types of skin tests, which are scratch, intradermal, and patch test. Scratch test. The scratch test is also known as puncture or prick test. It involves putting a drop of liquid onto your forearm that contains a substance you may be allergic to. The skin under the drop is then gently pricked. If there is localized redness, swelling, elevation, or itchiness of the skin over the test site, you are allergic to that specific allergen. Intradermal test. This test requires injecting a tiny amount of allergen into the dermis layer of your skin. Then the doctor will monitor your reaction. Patch test. A special metal disc with very small amount of a suspected allergen are tapped onto the individual bag. After that, the doctor checks for a skin reaction 48 hours later and then again after a couple of days. A patch test can also identify eczema. Number 2, blood test. Blood test may be used instead of or alongside skin prick test to help diagnose common allergies. Blood test also will be conducted if there is a chance that you will have a severe allergic reaction to a skin test. Allergic blood tests detect and measure the amount of allergen-specific antibodies in your blood. When you come into contact with an allergen, your body makes antibodies against it. Allergic blood tests may be referred to as immunoassay tests and include enzyme-linked immunosorbent assay and radioallergosorbent tests. Number 3, elimination diet. An elimination diet is a meal plan that avoids or removes certain food or ingredients so you can find out what you might be sensitive to or allergic to. There are two parts to elimination diet. First, the elimination phase to the reintroduction phase. For the elimination phase, stop eating the suspicious foods. You will need to read food labels carefully and ask how food are prepared at restaurants. Keep a food diary and write down everything you eat and note how you feel after you eat them. Your doctor will watch you for a few weeks while you try this. For the reintroduction phase, during the test, you are given the food you think you are allergic to in gradually increasing amount to see how you react under close supervision. This test is riskier than other forms of testing, as it could cause a severe reaction, but is the most accurate way to diagnose food allergies. This test is always carried out in a clinic where a severe reaction can be treated if it does develop.
Assalamualaikum, my name is MIZA and now I will present about treatment and prevention of allergies. The first treatment is over-the-counter or OTC treatment. This treatment is usually for patients who have less severe or mild allergies. A pharmacist will help to choose the best option based on the patient's symptoms. The medicine is taken for months at a time, mostly taken once a day, and the effect will last for 24 hours. Examples of OTC medicines include antihistamines that is used when the patient notices the symptoms of an allergic reaction. Other than that, decongestants can be used as a short-term treatment for blocked nose caused by allergic reaction. Cromolyn is a nasal spray that helps preventing or treating allergy symptoms, while Montelukast or Singular is used for asthma and allergic rhinitis. The second treatment is corticosteroids. This treatment is given via IV for rapid reversal of the effects of the media. It can reduce swelling and many other symptoms of allergy reactions. It's probably necessary to take an oral corticosteroids for several days after. An example of corticosteroids is decongestants, which can restore sinus drainage. The third treatment is allergy shots. Shots are given to people who have persistent and disruptive allergy symptoms. They do not treat symptoms, but altering the immune response can prevent future reactions. This is referred to immunotherapy. Patients are injected weekly with a gradual increase of doses for the allergen starting from tiny amount. It lessens the reaction in immune system to allergens and steroids, thus reducing inflammation and swelling, but may take several years to complete. Last but not least, treatment also involves probiotics. Several studies have looked into the use of probiotics, which are living microorganisms thought to be beneficial to the body, to treat allergies, particularly atopic dermatitis in infants. Next is about prevention. There are 6 most common allergens that can be prevented the allergic reaction. The first allergen is house dust mites. The number of mites can be controlled by using a vacuum cleaner with a HEPA, high efficiency particulate air filter, that can trap more dust mites than ordinary vacuum cleaners. Next, wipe surfaces regularly with a damp, clean cloth to avoid dry rusting, which can spread dust into the air. Clean the cushions, soft toys, curtains, and upholstered furniture frequently, either by washing at a high temperature or vacuuming. The second allergen is pets. Instead of pet fur, the flakes of the dead skin, saliva, and dry urine cause allergic reaction. This can be reduced by keeping pets outside as much as possible or limit them to a certain area in the house, preferably an area without carpet. Wash pets at least once a week and do their regular grooming outside. Also, wash all bedding and soft furniture pets lie on regularly. Increase the room ventilation with air filter, fans or air conditioning, or by opening windows. The third allergen is food allergies. Allergy towards foods such as nuts or seafood can be avoided by not relying on the menu description alone, for example, the content of sauces or dressings. Next, avoid places where different types of food could come into contact with each other, such as buffets and bakeries. Let the restaurant staff know the person's dietary requirements, including the severe of food allergy or intolerance. Always check what allergens are in the dish, as recipes and ingredients can change. The fourth allergen is hay fever. Allergy towards certain pollens depends on the seasons. Hence, check weather reports for the pollen count and if possible, stay indoors when it is high. Avoid drying clothes and bedding outside during high pollen count. Wear wrap-around sunglasses to protect the eyes, then shower and change clothes after being outside. The last allergen is insect bites and stings. When going outdoors, remember to cover exposed skin, wear shoes and apply insect repellent. Avoid wearing strong perfumes or fragrance as it can attract insects.